So it's not just the virus itself causing illness in patients.
No, it is not. Doctors say the effects of the virus are literally breaking people's hearts. Cleveland Clinic researchers found an increase in what is known as broken heart syndrome, a chest pain linked to physical or emotional distress. News 5's Emily Hamilton spoke with an expert about ways to rebound.
Heartbreak is a common thread in movies, pop culture, and music.
No one really expected to be in this situation, and that the pandemic has put dramatic, unprecedented stressors on our life.
And cardiologists are warning about the real and serious effects of a broken heart and the possible connection with the COVID-19 pandemic.
These are patients that are coming in presenting very similar to how patients come in with a heart attack. They have EKG changes, which are often consistent with heart attack. They have chest discomfort.
Cardiologists at the Cleveland Clinic studied 250 patients during the first 2 months of the pandemic who did not have COVID-19 but were instead diagnosed with stress cardiomyopathy.
When you get broken heart syndrome, it's usually in response to a profound stress that affects your body.
Researchers found that from March to May, 5 times the number of patients were diagnosed with broken heart syndrome than before the pandemic.
Like they're already stressed out because of COVID-19, and then when something else happens, it just tips them over the edge.
Dr. Grant Reed says a number of factors can cause heart function to deteriorate, like loneliness, financial stress, or just the overwhelming feelings of uncertainty brought on by the pandemic and stay-at-home orders.
You need to recognize when you need to seek help and say, okay, I need to take a step back and maybe disconnect from social media and not read so much, because that can stress us all out.
Dr. Reed added that during the pandemic, the number of heart attacks in patients locally have declined, but the number of sudden cardiac deaths has increased dramatically.
We're worried that people are avoiding coming to the hospital, maybe ignoring their symptoms when they should be coming to the hospital, because oftentimes heart attacks and strokes, these things are treatable.
Cardiologists say it's important to identify your own stress triggers and what relaxes you, and want to remind patients those solutions are different for everyone.
The message is that emotions of the mind, body, anxiety has a serious effect on our blood pressure, heart rate, and on our heart health, and we need to find ways of dealing with that.
Emily Hamilton, News 5.